You know, if you think about the past 40 years, there's a lot more targeted therapies that are available, and this has dramatically improved the lives of cancer patients. Our goal is to have a better understanding of what drives cancer cell growth and identifying the patient population that would best be targeted by HER3. Our lab has a multifactorial approach. Students will get an opportunity to do cell culture work, also look at the opportunity to work with mice. And then also our research is very translational in nature. So we have ongoing collaborations with oncologists. At least once a year, we meet with patient advocates and hear what their experiences are like. And then also we have cutting edge techniques using single cell sequencing, which is really important. That way you can get an understanding of how the cancer evolves over time. Every person's cancer is their own unique cancer. 1 out of 8 women will be diagnosed with breast cancer, and so there is certainly an urgency to identify breast cancers and then have treatment that will extend the lives of cancer patients. So if cancer research is something you have a lot of interest in, we would love to have you on our team.